Hello, my name is Winnie Sun, and I am a doctoral student at the Lawrence S. Bloomberg Faculty of Nursing, University of Toronto. And I'm going to be presenting a presentation about my research study about examining the relationship between therapeutic self-care and the occurrence of adverse events for home care clients in Ontario. This is one of the Health Promotions monthly seminar series provided by Community Health Nurses Initiative Group, and I'm pleased to be able to be a presenter for this session. I would also like to express my sincere gratitude to the CHNIG for the funding support of this research study through their research awards to make this research study possible. The focus of my seminar today is that I would like to provide you with the findings that I got from my qualitative work conducted as part of my mixed method study in examining home care safety in relation to self-care and informal caregiving. The qualitative work is part of a mixed methods research that include a quantitative research that looked at the relationship between self-care ability and the occurrence of adverse events using secondary data analysis. And then today I'm going to discuss with you the findings of my qualitative work that I received through the qualitative interviews with my client. Currently, the data analysis is still ongoing, and therefore the current results are preliminary findings. I hope that in the future I would be able to share with you the final results once the complete research is being completed. The objectives of today's seminar is to provide you with the insight into the safety problems related to therapeutic self-care and caregiving encountered by home care clients and their informal caregivers in the community, and also to increase our understanding of the role for the community health nurses in improving client self-care ability to reduce safety-related risks and burden for home care clients, with the emphasis on the needs of geriatric populations. So, regarding the current context of home care, as patients are being discharged sooner and sicker, home care plays a very important role in restoring and encouraging self-care in clients with chronic diseases. However, the current trends in home care suggest that fewer resources are being available to support the long-term care clients with chronic healthcare needs. And this problem could be problematic because many home care clients, especially older adults, are at increased risk for losing independence in self-care. And this situation can put clients in unsafe situations, leading to safety events or adverse outcomes. So underlying all of this is a concern about the quality and the safety of our current home care services to support chronic disease management. In today's world, with the increasing rapidly number of older people who require home care services, clients must possess or develop self-care ability in order to manage their health safety in their home. So there's the research gap that's being identified based on the review of the current literature. While patient safety outcomes are well documented in acute care settings, only limited data that exists about adverse events experienced by home care clients. And also there's a lack of research that explores the relationship between client self-care ability and safety outcomes in home care settings. In particular, very little is known about the concept of therapeutic self-care in the context of home care. So, in regards to the definition of therapeutic self-care, my research study will define therapeutic self-care using the definition developed by Sardini and Doran. And they define therapeutic self-care as the ability to take medications as prescribed, to recognize and manage symptoms that may be experienced such as pain, to perform and adjust regular activities of daily living, and to manage changes in conditions. So Based on the research gap that's been identified, there are 3 research questions that I would like to explore in my current qualitative research study. The first one is, what are the safety challenges and concerns home care clients and their informal caregivers report related to therapeutic self-care and caring activities? What supports do the clients and caregivers identify as important and needed to address their safety challenges and concerns? And finally, what are the roles do clients and their caregivers identify as important for home care services in supporting therapeutic self-care and informal caregiving? So the purpose of the qualitative study is to look at 2 populations. The first focus is on the older adults. Given the aging population and the trend towards the use of increased use of home care and reduced use of institutionalized care settings, the number of older adults with chronic conditions being cared for at home will continue to increase in the future. And therefore, we need to understand the needs of the older adults in terms of their home care needs. And the other focus of the qualitative research is to look at informal caregivers. Current research suggests that very few seniors are receiving home care that are actually managing the care themselves. Apparently, out of 131,000 home care clients who are at the age of 65 and older, 98% of those clients are actually getting help from an informal caregiver, and that is based on the statistics coming from CHNIG. So the study chooses to focus on older adults and informal caregivers as a dyad to explore the nature of safety challenges and concerns related to therapeutic self-care and caregiving. It is very important that decisions regarding client services in home care must take into account of what older clients need in order to manage their own health, and also what the informal caregivers need to provide care safely to their loved ones. The qualitative study method is using one-on-one in-depth semi-structured interviews with older home care clients and their informal caregivers. Recruitment took place at one of the home care organizations in Ontario, and the home care supervisors were asked to help with the recruitment process by identifying potential clients and informal caregivers who met the inclusion criteria. I've also requested to have diversity in the sample so that I could explore different, in terms of balance of gender type, age, types of chronic conditions, and also geographically diverse in terms of my sample. In terms of the inclusion criteria, clients who were mentally capable of participating, able to communicate in English, long-stay home care clients, that means more than 60 days of staying in home care, who are 65 years of age or older, and have a primary caregiver such as a family member, friend, relative, or neighbor, could be considered participating in this research. And in my study, paid caregivers are not eligible because I am looking at the informal caregivers in terms of looking at their needs and safety concerns. So once the individuals have met these inclusion criteria, the potential clients and informal caregivers were followed up by me to explain the research study, obtain consent, and to schedule interview date, time, and location. In order to better capture the differences in perspective, the interviews were conducted with each client and the informal caregiver in their home on the same day, but the client and the informal caregivers were interviewed separately, meaning that they were physically apart from each other in their home during the interview process. The interview also began with collecting demographic information, descriptive data, and each interview took about 30 minutes each. And my final sample has 15 home care clients paired up with 15 informal caregivers. The interview is conducted until data saturation has been reached. An interview guide was used to facilitate the interview process with focus on the following 4 areas. First is to look at client and caregiver experience with therapeutic self-care in their homes, to explore safety challenges and concerns related to therapeutic self-care and caregiving activities, and to understand support that's needed to address those safety challenges and concerns, and to examine the role of home care services in supporting therapeutic self-care and caregiving experiences expressed by the clients and the informal caregivers. So in my final sample, there were 15 participants for the clients, and 8 were female, 7 were male, so there's a good balance between the 2 gender. There are, over the age of 65, there were 8, and then over the age of 75, there's 7, so that's also a good balance between the younger old and the old. And in terms of multiple chronic diseases, I was able to have participants with multiple types of chronic conditions that were commonly seen in home care settings, such as cancer, diabetes, COPD, and stroke. And also, all of the clients have personal support services, some with nursing support, physiotherapists and occupational therapist support, speech, social worker, and nutritionists for follow-up in terms of health professional support. For the informal caregiver, there were 10 females and 5 male. Among the 10 female, there were 5 daughters, 4 wives, and 1 sister. And in terms of male, there are 3 husbands and 2 sons. And the age of the daughters and sons were from the age of 30 to 60 years of age. And the age of spouses were from the age of 65 to 84 years old. So you can see that the informal caregivers themselves, they are also aging, frail, elderly, informal caregivers. They are trying to support the care of an aging adult. And also, all of the study participants live in a geographically diverse regions. So I was able to get individuals from more urban areas versus the rural areas. For the qualitative data analysis, this study used a qualitative description to provide a comprehensive summary of the straight descriptions of the phenomena of interest. That involves the presentation of the facts of the case. And I also choose to use the conventional content analysis to help with data analysis. This is appropriate because the existing theory and research about therapeutic self-care and safety outcomes are quite limited in the current literature. And therefore, the conventional content analysis can allow a more comprehensive summary of the descriptions of the phenomena of interest, so which is quite appropriate to use in my study. The emergent themes from client and informal caregiver data sets were analyzed to identify similarities and also to compare differing perspectives. So this is a diagram to summarize the conceptual idea about my qualitative study. So based on the results from the qualitative study, clients and informal caregivers talk about how the unit of care in the context of home care is very different from the acute care setting. The difference is that the informal caregiver, the client, and the home care all play a very important role each to contribute to self-care and caregiving, and that they interact with each other to have a nature of a relational relationship. So in this diagram here, the arrows are pointing at each of the player to show the relational aspect of this relationship. and also the boxes showing the informal caregiver, the client, and the home care services such as the community health professionals are the important players within that unit of care in the context of home care. And the arrows pointing at the adverse events, meaning that when these individuals are interacting with one another, and if there's any type of imbalance or lack of support from one role or the other, possible adverse events such as challenges and concerns could be the outcome. So here's another diagram to show the more details about the information that I got from the results of the interviews. The caregivers and the clients talk about the different types of safety challenges and concern. So there are the physical safety, emotional, instrumental, cognitive, financial, social, and environmental safety. The client and informal caregivers also talk about how home care and community health professionals can provide them with support to help support the clients and informal caregivers to overcome all of these types of safety challenges and concerns. And the client also talk about there are different aspects of therapeutic self-care. There is the knowledge aspect, the skill, and the belief. And that applies to the same thing to the informal caregivers, where the aspects of caregiving also include the aspects of knowledge, skill, and belief. And that client and informal caregivers talk about the importance of getting support from community health professionals to help them to increase, improve these aspects of knowledge, skill, and belief so that the self-care can be promoted and also to reduce the burden of caregiving. So I'm going to talk to you in details about each of the safety, type of safety, and the examples of type of safeties that were explored during my interview from the client's perspective and also the informal caregiver. The first safety that I would like to talk about is physical safety. A lot of times when we talk about safety concern, that is the one thing that a lot of the health professionals would focus on, is the physical safety. So here are some of the examples that clients talk about. Falls is the major safety concern for the client. And then they talk about problem with stairs climbing, because climbing the stairs can also pose a risk for falls. And also they talk about limitations of activities of daily living because of pain, lack of pain management, and also physical weakness. And they talk about the development of pressure ulcer is also a safety concern, because a lot of these clients do not know, what signs and symptoms to look for when there's development of pressure ulcer, and also the treatment of and the prevention of pressure ulcers. Wandering risk and being forgetful and poor memory were also some of the safety concerns that were expressed by the clients. The informal caregivers also talk about physical concern in terms of client falls. And when there's client falls, that leads to back injury for the informal caregivers. There is an informal caregiver talk about how one time the client fell, and then she has to pick up the client by herself because there's no one there to help her, and she ended up having a back injury. And that back injury lasts for a long time, because it's a chronic conditions now for the informal caregiver. So back injury is a major issue for the informal caregivers in terms of lifting and transferring clients. The physical demands of care, fatigue and lack of sleep is a major issues for informal caregivers. The informal caregivers talk about how being a caregiver is a 24-hour job, and that fatigue and lack of sleep is a safety issue. And they also talk about how client resists care. A lot of times, client not being compliant with medication, or client not complying with the exercise plan. So this resistance to care pose a safety risk for the informal caregivers as well as the client themselves. And the management of treatments such as wound care and oxygen care were challenging for the informal caregivers because of the lack of training and education about the treatments. Then the client talk about emotional safety. The examples are being alone, the sense of isolation, sense of insecurity. For example, client talk about how they are being isolated in their homes, and that they are scared that there will be home invasion because the client is being by themselves at home, and what if something happens, like who's going to help them? So the sense of insecurity is huge. Loneliness, feeling depressed is one major emotional issues that they talk about. Feeling stressful is related to the learning new things on an ongoing basis, and feeling overwhelmed related to life adjustments. The informal caregivers also express concerns and worries about what will happen if the loved one is being left alone. So the fear of the unknown, feeling overwhelmed related to kind care, and also feeling stressed out. So caregiver distress is a major theme that come up from the emotional safety dimension. In terms of instrumental safety, clients talk about managing medications is huge in terms of their lack of ability to carry out instrumental activities of daily living. And that is quite consistent with the informal caregivers, where they also identify medication error as a #1 concern for them. Because the client talk about how they are not able to know what type of medications they are currently on, and why are they on it, and how many they should take. All they know is that they would take the medication from the blister pack, and then if the blister pack it falls on the floor, then the client will have no idea what pill to take and how much and how to take it. So the client and caregivers both talk about the difficulty of managing medications without the help from the pharmacist to provide blister pack or dosette. The caregivers and the client have no way of knowing how to manage those medications. So medication errors is a major instrumental safety that both populations talked about. The client also talked about difficulty with traveling in terms of difficulty to access transportation. And informal caregivers also express concern about traveling to and from the doctor's appointment, and the difficulty with transferring patients who are immobile or who has physical disability that needs a lot of help with transferring. In terms of kitchen safety, clients talk about how meal preparation can be a challenge because client can get forgetful to turn off the running tap, to turn off the stove, or even turn off the oven when baking. So the client talks about how carrying out the instrumental ADL with meal preparation is a major issue. And then the informal caregivers also talk about the physical demands of doing housework, not just inside the house, but also outside the home for the clients, such as doing gardening, shuffling the snow, mowing the lawn for the clients. So all of these are the instrumental safety concerns that were expressed by the informal caregivers. The cognitive safety, clients talk about making choices that have major implications for their health. So the client talked about how problem-solving ability is important, and that they have to know what to do when problems arise and what to handle and how to handle new situations and issues. So oftentimes, clients express concern about their lack of problem-solving ability and the decision-making capability to make all these important choices for themselves. The informal caregivers also talk about their burden of making important care decisions on behalf of their loved ones, and that what if they make one decisions that could have major implications for the care of their loved ones. So they talk about that huge burden in terms of cognitive safety issues and their difficulty with figuring out solutions when faced with problems, and also how to encounter the unexpected events. Like the feeling of you on your own, it's a huge theme that runs across the informal caregivers when they talk about the cognitive safety. And then there is the financial safety. Clients talk about financial insecurity because of the loss of employment due to their current illness, the loss of financial control because they're no longer able to manage their own finances, and that they have to shift that responsibility for the informal caregivers to carry out, and a concern about getting funding for equipment, supplies, and medications. It's a major financial burden on the clients. The informal caregivers also talk about the employment insecurity because of their need to taking time off work, also the loss of income because they have to take the client away for doctor's appointments and to and to take care of their loved ones. And the informal caregivers also talk about the lack of funding support from home care. That can mean that the informal caregivers will need to take that responsibility from the home care when funding is not available, such as they would have to purchase extra hours for private respite care services, or to pay for their own equipment supplies or medication needs. So all of these lack of funding, it's pose a very huge financial burden on both the client and the informal caregivers. Social safety is another safety issue that were identified by the client, such as things that clients used to enjoy doing become a safety risk. The client talks about how gardening, knitting, or baking, or going away on vacation were some of the things that they enjoyed to do in the past. However, because of their illness, they can no longer enjoy what they used to enjoy. So their enjoyment related to the hobbies, interests, and traveling can no longer exist. And that gives the client a sense of isolation, socially isolated. Informal caregivers also express the same concern related to the social safety. They talk about how they were unable to spend enough social time with their own spouse and children because of the commitment with the client care. And they also talk about how it's very difficult for the caregivers to go away on vacation because they just don't know what will happen to the client when they are away. And that worries, constant worries, prevent them from taking vacations or taking breaks from providing care to clients. And that again leads to caregiver distress. Informal caregivers also talk about how friends and families used to come to their house to visit, and they don't do that anymore because the client is sick. Their friends and relatives see the client as a different individual. So they talk about how that becomes a social issue for them because their social relationship with their friends and relatives were diminished by the client's illness. In terms of environmental safety, clients talk about the need for home modifications to make their home fit the care needs. So a lot of the clients talk about how they have to move to a new home in order to move closer to the caregiver, so they have to give up on the old house. And they also talk about the difficulty in making the home fitting their care needs and making a lot of the home modifications, such as having equipment, supplies around the house. And they talk about how that their home becomes another hospital for them. And they also talk about the invasion of privacy, meaning that they have to take the care to their private places by having the PSW and the healthcare workers coming into their home to provide care, and that's an invasion of privacy. Informal caregivers also express concern over safety hazards in the home, such as equipment, supplies, fall hazards, wheelchair accessibility concerns, the icy walkway. They also talk about fire hazards related to the use of oxygen and home invasion by strangers, such as like healthcare workers coming in and out. And that for clients who live in the more rural areas, express concern about the fact that sometimes home care workers are not able to visit the client because of the poor weather. And when the home care worker is not able to make the visits, the informal caregivers will have to take that responsibility themselves. So all of these examples are environmental safety concerns. And then in my research, I asked them, the clients and the caregivers, what are some of the support from home care that were identified as helpful or important from the perspective, from their client perspective and informal caregivers' perspective. So for physical safety, clients talk about the importance of having fall assessment and prevention strategies provided by nurses. Exercise plans developed by physiotherapists were very important to improve their activities of daily living. However, the client talked about how the waiting list for physiotherapists it's a very major issue that prevent them from improving ADL needs, because they have to wait for a long time for the wait list in order to get physiotherapist services. And also the care support from PSW were considered to be very helpful in terms of helping them with ADLs and instrumental activities. Physical safety for informal caregivers, the supports were identified as the education about proper lifting and transfer techniques offered by nurses or physiotherapists, providing respite hours through home care services, such as PSW coming to clients' home to visit the client once a week, once a day, like once a week, or even like once a day every day, to check on the clients, to making sure that the clients is okay at home. That was considered to be very helpful in terms of respite care hours. And also nursing education about treatment and care plan were considered to be important. For support for emotional safety, clients talk about early detection of loneliness and depression by nurses were helpful. A lot of times clients themselves do not know that they are experiencing depression, and that the assessment by the nurses were helpful so that they can get early treatment. Clients also talk about pets as important companion, and also they see their pets as part of their informal caregivers. So nurses could encourage clients to use pets to help alleviate loneliness and the feelings of alone. It's an important support for emotional safety. Clients also see PSW as part of their families, so having consistent worker is very important. Informal caregiver also talk about respite care for caregiver relief, and also the use of technology measures such as Lifeline can provide the informal caregiver a sense of security. Getting help from home care to navigate services in the community also help to access support to support emotional safety issues. In terms of support for instrumental safety, clients talk about helping the client with medication management, such as helping the client understand what medications to take, why and how much, and also having assessment by the occupational therapist regarding home safety, such as kitchen safety and bathroom modifications to meet the safety needs of the clients. According to the informal caregivers, they talk about the importance of having medication review by the nurses to help caregivers to manage medications so that there would be a reduced risk of medication error. Also to allot more PSW hours so that the caregivers can help client perform the instrumental activities of daily living for the client, such as going out for grocery shoppings, doing banking, and to have the respite care. For cognitive safety, clients talk about the importance of having warning from nurses about possible problems related to their own conditions so that they are better prepared for self-care management. And also to get education from nurses about what to do when problem arises. And they talk about be prepared for the worst, it's important, so that there is no surprises, so that the client doesn't feel that they are being left alone, and that they can improve their self-care ability by increasing their problem-solving ability as well as decision-making capabilities. The informal caregiver also talk about feeling in control is very important. And that could be done by having education from nurses to talk about what to do to take control of the situation. And also providing support to the caregiver in the development of routines and care plan for the loved ones is important. They talk about having set up a routines can help them through the day-to-day tasks of providing caregiving activities. In terms of support for financial safety, referral to help client obtain appropriate funding support for the equipment, supplies, and medications were seen very important, such as the Veteran Affairs, March of Dimes, or CCAC support were considered very helpful. Social worker can also help identify some of the other financial resources in the community. For the informal caregiver, adequate respite support when the caregiver is working is considered important, so that they could have more time to focus on their own employment, and also have the time that they could have their own time to alleviate their caregiver stress. Also, more flexible scheduling of the home care workers to accommodate caregiver working schedule, so that could help secure their own employment. The informal caregivers talk about how oftentimes the home care workers will only come during the daytime when the informal caregivers are not present, and they express the frustration over that because the informal caregivers think that if sometimes the home care workers could come during the time when the informal caregivers are not working, such as in the evenings, so that the informal caregivers can see what the healthcare professionals are working on with the client, so they can better able to provide that support in terms of making sure the client is compliant with the treatment plan. So they talk about how having more flexible scheduling of the home care workers could actually help the caregivers to support client self-care ability, and to also better able to accommodate their caregivers' working schedule. In terms of support for social safety, clients talk about helping from the occupational therapists to identify and develop new interests and hobbies that are considered safe to perform by the client, and also to help client navigate community resources for social support, such as adult day program, so that the clients can increase their socialization. And for informal caregivers, referral to support group for social and emotional support, such as caregiver relief groups or support groups, were considered to be very helpful, such as Alzheimer's Society or Cancer Society or MS Society. They do offer a lot of the emotional support group for the informal caregivers. Longer respite relief time so that the caregivers can take longer breaks in between, and also to be able to access transportation services to take the client to and from appointments, such as having volunteer drivers to help take the client to and from the appointments, to help alleviate the burden from the informal caregivers to do the traveling. That could be another support for social safety. And for environmental safety, clients talk about assessment of environmental risks and hazards by nurses and occupational therapists are very important. Also, the respect for privacy, knowing that this is their home, the client's home, and not your office, not the home care worker's office. So the respect for privacy, and also be sensitive to the client's feelings about invasion of their own boundaries. Informal caregivers talk about support for caregivers to make home modifications that could meet client care needs, such as having suggestions for appropriate equipment and appropriate supplies to make home safer for the client. And also having continuity of care from home care workers is very important. The caregiver talk about the need for consistency and not changes of the workers, because the caregivers talk about how consistency of the workers can make the routines, could help establish the routines for the client, and that could really support the client in their development of self-care. In terms of the role of the client, informal caregiver, and home care, there were three aspects of therapeutic self-care and caregiving that were identified. The first one is knowledge, skill, and then belief. In the aspects of knowledge, for the therapeutic self-care, what the client talks about were they need to have increased knowledge about their medications, the use of medications, what to look for signs and symptoms, and the purpose of their treatments, and when to get help appropriately, and how to prevent future problems. For example, if there is a fall, how do they prevent falls in the future? Were some of the knowledge aspects that client would like to know in relation to their self-care. Informal caregiving, knowledge about what to look for changes in the client conditions and how to support client with better medication compliance and better compliance with treatment plan so that they don't have to fight with the resistance to care. Were some of the knowledge that informal caregivers value. In terms of aspects of skill, for clients, in terms of therapeutic self-care, they talk about developing self-care skill is a learning process. And here's the quotes that coming from the client. Self-care takes time. Some days you're good at it, some days you're bad. You just don't know what to expect from day to day. It takes patience to develop. Keep trying and taking small steps. It is like trial and error. Informal caregiving, also the informal caregivers also talk about the struggle between providing care and promoting self-care skill. Here's a quote from an informal caregiver that talks about the struggle. I know I need to encourage mom to do things on her own, but part of me is worrying about her as she takes risks when doing things herself. There needs to be a balance. I always make sure mom knows when to ask for help, then I just let her do it. And those quotes illustrate the aspects of skills in relation to therapeutic self-care and informal caregiving. The aspects of belief. So talk about what self-care means. Client talk about self-care means independence. And here are some of the quotes to illustrate that. It's hard work when you have an illness to deal with. But independence is very important to me. Determination, pure determination is the key. Don't do everything for me because you need to finish your work quickly. I need time to learn. Otherwise, I'll give up. So these quotes talk about how client really wants the healthcare workers to realize that self-care skills needs time to develop and learn, and that a lot of times home care workers would like to quickly finish their work, so they would like to do everything for the client. But the client, they talk about how that is actually detrimental to promoting their independence, because when they do everything for them, they're not learning. So healthcare workers need to step back and let the client do it themselves, even though that may mean that it takes longer time for the healthcare workers to do the work. Informal caregiving means that looking after needs of a loved one to support independence. And here's some of the quotes to illustrate that. It is hard work because it is really a full-time job. But pushing her through the learning curve and letting her having the independence is rewarding. Caregiving is a necessity and it is out of love. So here are some of the implications for home care and community health professionals in the related to the three aspects of therapeutic self-care and informal caregiving. For the aspects of knowledge, understanding that there are different types of safety in relation to self-care and informal caregiving. And quite oftentimes, healthcare professionals would focus on the physical safety, but then there are also different dimensions of safety that we are actually not neglecting or not paying attention. So it's very important to realize that there are different types of safety issues in relation to self-care and informal caregiving. Also, incorporating the screening tools to assess concerns in relation to the different aspects of safety in order to mitigate safety risks in the home. So having the safety tools to assess the different types of safety in relation to physical safety, emotional, cognitive, financial, instrumental, and also the environmental safety issues are very important. Aspects of skill. Care plans develop individualized interventions targeted at providing support for each aspect of safety concern to promote self-care skill and informal caregiving. So once we are able to assess the client's safety concerns and needs, we can develop care plans that is more targeted towards providing support and interventions to promote self-care and to mitigate safety risks. And to realize that self-care needs time to learn, and therefore continuity of care and consistency of worker is very important. And the aspect for belief, we have to realize that home care and healthcare professionals understand the unit of care for home care consists of the clients, the informal caregivers, and also the healthcare professionals themselves. Collaborating in care and engaging in shared decision-making, such as offering choices and options, are keys to developing rapport and also to give the client and the caregivers their sense of control. And there's also the interconnection between all the players in promoting therapeutic self-care and informal caregiving, and also to contributing to safety problems due to lack of support from each player. So there is a concern that we have to realize that when there's a lack of collaboration between all players, safety issues and adverse events may develop. So it is very important to look at the collaboration in care in the context of home care. For future analysis, these qualitative results will be help explain and build upon the quantitative study that was conducted using secondary data analysis to help explain expected or unexpected results. And the results from the quantitative findings will also clarify the themes emerged from the qualitative descriptions. And also the results from the qualitative findings will also help enhance the findings from the secondary data analysis in the quantitative study. So as I discussed today, the qualitative interviews results are quite preliminary, and I hope there will be an opportunity in the future where I could discuss with you the results of my quantitative study and also the mixed methods triangulation data analysis. If there's any question, you can contact me at winnie.sun@mail.utoronto.ca. And thank you again for CHNIG for giving me the opportunity to provide you with today's health promotion seminar series. And thank you for being the audience of the seminar.